All right, now to something everyone seems to be talking about, peptides. You've seen them all over social media, maybe even in your doctor's office, but what are they exactly, and are they right for you? Joining us now is Dr. Sarah Siavoshi. She's a San Diego neurologist who specializes in peptides. She's with brainrx.com, because peptides, they have something to do with your brain.
Yeah, a lot to do with our brains. So a lot of people are surprised to know, first of all, what are peptides, right?
Right, what is that?
It's such a vague term. It's like saying plant. Is it a tree? Is it a flower? What is it? A peptide is just a short chain of amino acids. And it's a we have many naturally occurring peptides in our bodies. Insulin is a peptide. Oh. What's the most famous peptide right now? Ozempic.
I had no idea that a GLP-1 was a peptide.
Yes, GLP1s are peptides. So I am a neurologist. I am also an obesity medicine physician. And I started prescribing a lot of these GLP-1s because they work on a brain level. A lot of these peptides that we're talking about are signaling molecules in the body. They signal hormones, they signal blood sugar, they signal collagen production, they signal healing, right? So that's why a lot of people are so excited about them, is their potential to signal different pathways and turn pathways on to help with regeneration and longevity.
What does that mean, they signal? They cause it to do something, like we're signaling collagen, so we're instigating it to do something in your body?
Yeah, so it depends on what peptide we're talking about. There's so many now, right? One of the most famous ones, one of the hot ones, okay, that everyone's excited about is like GHK-Cu, copper peptides, okay? This is a peptide that a little short chain of amino acids that binds to copper in our body, okay, and helps to signal that copper to produce collagen, elastin, which is why a lot of people are using it to support their hair follicles, to support their skin, and a lot of people are using something called like the glow stack, which combines—
I've heard this.
Yeah, copper with different regenerative healing peptides, anti-inflammatory peptides, to reduce inflammation in the body and to help your skin and your hair glow and grow.
So people can have this injected, but I also see peptides in skincare. So does that work if you buy a serum that has a peptide in it?
Yeah, it does. And so I tell people a lot of the times when they come to me for, again, many different peptides. Okay, we're talking about one in particular right now, copper. There are lots of serums that have copper in the actual face serum, and it's wonderful. It does work very well, and it's very nice for your skin. When you inject a copper peptide, you are now having this copper work a little bit more potently, but also systemically throughout your body to help whole skin regeneration, right? I just had my third baby. I noticed a little bit of crepiness on my skin now. I'm in my 40s, right? Like, it's really nice to use these copper peptides to help with your whole body collagen, skin production. And also there's some promise for not just the GHK-Cu, the copper, but some other peptides, but also the copper with gut lining and gut healing. So when you use them systemically, they sort of have a different purpose than when you're using them topically.
So what is the one that would be for gut health? Because you hear that all the time. And if your gut health is messed up, if the way that your gut is, it creates so many other diseases.
Yeah, so there is one right now, BPC-157, that many, and the copper peptides, as I said, but BPC-157 is probably one that people are going to more to help support gut healing. I've had people with leaky gut, people with ulcerative colitis, Crohn's, who've used this and really help and really feel like it's helping with their inflammation in their colon, inflammation in their stomach. So people actually use this one because it increases oxygen production, blood flow to that injured area. So people are using it for like an injured shoulder, an injured knee, an injured hip. With a lot of benefit. It's pretty great.
I know someone right now, he's a computer engineer. He has some kind of neck pain, nerve pain. It's gotten to where his arms are numb and he's not able to work. I wonder if a peptide could possibly help him in some kind of healing.
Yeah, I think if you were to ask another provider, they'd say yes, just because they want to sell this, right? But I really look at things from an evidence-based, first of all, I wish that there were more human studies for peptides. That's one thing I want to say. We don't have a lot of human evidence for that. And that's really complicated, and it comes down to billions of dollars that go into producing drugs. And right now, a lot of these drugs are not patentable. So you don't put billions of dollars into a drug that you're not going to be able to make billions of dollars off of. I can tell you that many people are seeing lots of benefit, and they're awesome, and they're great, and we've seen really great safety profiles. But as a neurologist, I also know that your friend who probably has a nerve impingement in their cervical spine is probably not actually going to have much benefit from this, right? So you have to know when it's going to be beneficial,
and when it's not.
And you don't want to practice, like, I don't want to practice grifter medicine and be like, take a peptide for everything.
Right.
There's a time and a place.
Right. Right. Okay. So I wanted to ask you for weight loss. That they seem to be working so well for people, but it's also what it's doing in their brain.
Yeah. Okay, so your question comes down to GLP1s, like the Ozempic drugs, semaglutide, tirzepatide, Wegovy, Zepbound, all of these amazing meds. Yes, and that is exactly why I got into them. I saw way too many people walk into my office as a neurologist with early onset dementia, with white spots on their brains, with brain fog, and I was really upset by seeing that. They were too young to have this stuff happen to them. The GLP-1s are not just weight loss drugs. They are not just vanity drugs. We're not just seeing them have people shed tons and tons of weight. We are seeing people's brains benefit dramatically from them because of the fact that they regulate sugar on a neurophysiologic level, right? Like decreasing sugar in our bodies is amazing. Decreasing sugar buildup in our brain vessels is incredible. It reduces those white spots on the brain. It keeps your brain full, reduces your risk of multiple types of dementia. So it's incredible. I love these meds for many reasons, and that's why a lot of people are using the GLP-1s, microdosing them, not to necessarily lose tons of weight, but make better food choices and reduce brain and body inflammation.
That's amazing. So who is a candidate for, because we just mentioned someone that he wouldn't really be a candidate, who, I guess you have to go in and talk to your doctor. What kind of questions could they ask? What do people come in and ask you and decide, how do you decide if they're a good candidate or not?
Yeah, so when people come and see me, they fill out some forms, some surveys to allow us to see, first of all, where's this person's health status is, what are their goals, what is their medical history. All of that is very important. I like to make sure that someone does not have any current active cancer, that they've been screened for cancers, not with the GLP-1s. The GLP-1s, let me just tell you this, people have this wrong. GLP-1s reduce our risk of over 13 types of metabolic cancers. They are incredibly safe. We have seen no increased risk with our Ozempic type drugs. Amazing. Liver cancer, pancreatic cancer, many different types of cancers are having reduced risk with these. The peptides, we have not seen any increased cancer risk, but because they help to increase cell turnover, I don't want to fan the flame if there is an existing cancer, if there is some sort of an active cancer. So I tell people, if you have not been screened for cancer, if you have an active cancer, I don't like peptides for you. The other peptides are what I'm talking about. Remember, it gets confusing because GLP-1s are one type of peptide. I'm talking about like the copper peptides, the BPC 157. So otherwise, I haven't seen any side effects with them. They're incredibly safe. We haven't seen any issues with them.
There are millions of people taking them.
Millions and millions of people taking them, doing incredibly well, feeling better, feeling younger, feeling like they have more mobility in their joints. They're healing faster. For example, I had a patient that just came to me the other day and she was like, I don't want to get shoulder surgery. They're telling me I need shoulder surgery. Can I do BPC 157? And I said, yes, because your scenario is much like many others who I've seen be able to either delay surgery or not have to resort to surgery because their ligaments are healing because of the capability of peptides.
What is the glutathione?
Glutathione is also a very interesting thing that people are using. It can be great for longevity, but it also tends to brighten the skin. So a lot of people are using it for that reason. I like that. I think the copper is probably a little more beneficial, but glutathione has a role as well.
And so what about NAD? How does that fit into all of this?
Yeah, NAD is not a peptide. NAD is a cofactor for our cells. our cells require NAD to produce energy, ATP, right? Like basic sciences. ATP is necessary for your cells to look good, be young. And as we age, our NAD levels decline, which means our cells start to look older, and they don't produce ATP as robustly.
Okay.
So if you can get injectable NAD, which is a better way to flood the system and potentially get that NAD into the brain, then your brain can get some extra NAD to boost its ATP production. And many of my patients who take it feel like it really helps them to feel more sharp, more energized. And it's just a really well-rounded longevity, non-peptide substance that helps your, again, energy.
I see it in supplements. Does your body absorb it in a supplement or in like a drink or something?
I mean, potentially, I think that there's a lot of oral supplements that are good. I think a lot of NAD supplements probably don't work as well as we'd like them to.
Yeah.
Injectable NAD is more likely to be better simply because of how it's absorbed.
Now, I've heard that with the GLP-1, I've read online people complain about they're tired, they don't have energy. Is that when you start doing that stack of trying to figure out how to feel, maybe you're not feeling the best on it? I don't know. Maybe they're not eating enough calories.
I think it comes down to a few different things. There are some people who start this and yes, their appetite is too suppressed and they need to reduce their dose. This is why it's so important. Like with our team, we are constantly checking in. You need to have someone who is checking in with you and adjusting your dose based off of your side effects. If you just go to a place and they're giving you these injections and they're not checking in with you and they're not adjusting your dose properly, you're gonna have side effects. You're gonna feel fatigued. You're gonna feel all kinds of things that you're not necessarily supposed to feel. Again, a dose adjustment can go a long way, and you're absolutely right. If you're not having enough calories, that can make you feel pretty badly. I have some people that take GLP-1s and take NAD with it, feel really, really great. And you know, something that I don't make any money off of, I don't even sell, is creatine. Creatine is an amazing brain supplement. It's not a peptide, it's an oral supplement that has some really good evidence for brain health. Everybody should be on creatine. I put it in my coffee every single morning, right? Like this is a really good one to help with energy. If you're not doing that, you should.
Okay, that's good to know. How long does it take to start seeing or feeling the effects? You can break it down into the GLP-1 and then also like the copper or even the NAD.
Yeah, I tell everyone 2 months. Give it 2 months at least. GLP-1s is a long game. GLP-1s are a long game. You can start it for a few months if you've, like a lot of people, like let's be real, a lot of people are using it now to drop like 10, 15 pounds.
Yes.
Okay, they're not using, like a lot of people are still using it to drop 50, 60, 100 pounds and it works amazingly well. But a lot of people are using it to drop a few pounds or they're using it to reduce food noise. Someone like me, I'm skinny, okay? I microdose a GLP-1 to help me make better food decisions so that I'm not, when I'm starving, grabbing a bag of Cheetos, which I love a bag of Cheetos. And it's really, really great for that. So yes, you can use it short term, but I will say that like, will I ever have a GLP-1 out of my life? No, I love it, it's amazing. I will take probably a microdose of Tirzepatide every 2 to 3 weeks. I have a low dose. I space mine out every 2 to 3 weeks. And a lot of, I'm using myself as an example, but I have many patients that are on the exact same protocol. They space it out every 2 to 3 weeks to reduce their food noise or maintain their weight or to just keep their weight at the goal weight that they want. Safe goal weight, by the way. We don't want to undernourish people. But it works really well for that. And again, it is so beneficial for so many other aspects of our health. It's an anti-inflammatory peptide.
I posted, we have to go, but I wanted to get to this one question because I posted on Instagram and asked people to send in questions, and they did. Here's the one that someone sent. Someone asked, if you have been diagnosed with breast cancer, been through treatment and are in remission, are peptides good for you, especially if you had estrogen, progesterone positive breast cancer? What would you say to that person?
Ooh, I love this question because it's so relevant. I want you to remember that even a few years ago, HRT was so taboo, okay? Now what do you see? You see endocrinologists prescribing combination HRT, including estrogen, for even people with a history of breast cancer.
Yes.
Because they remove the black box warning.
Hormone replacement therapy, yeah.
Hormone replacement therapy. And it's the same concept. If in the right scenario, if you have a person who is either a cancer survivor or who is undergoing regular screening and they are wanting to use a peptide for longevity, it can be very beneficial. It can be very beneficial and very, very safe. So you've got to talk to the right person. If you're a person who is a cancer survivor or a high risk of cancer, I strongly recommend not just buying this stuff online. I strongly recommend talking to a provider and really going through your nuanced medical history and coming up with a tailored plan.
Okay. All right. Thank you so much. This is great. drbrainrx.com. That's who you are on. And on Instagram, you're Dr. Brain.
SD.
Dr. Brain SD for San Diego. Sarah, thank you so much. This is
so
informative. This is great. This gets us going. All right, you guys stay with us. We'll be right back.